In this podcast episode, Hannah Kleinfeld explores the profound impact of gut health on various aspects of human well-being, ranging from the effects of alcohol consumption to the intricacies of early childhood development, fertility, and hormone balance. She highlights how the gut microbiome influences immune function, metabolism, neurodevelopment, and chronic disease risk, while offering practical guidance for nurturing gut health across different life stages. Hannah explains that alcohol is inherently inflammatory and detrimental to the gut, especially with frequent drinking. Alcohol depletes beneficial gut bacteria, which play an essential role in supporting liver function and detoxification. This depletion not only harms the gut environment, but can contribute to systemic inflammation, exacerbating the hangover experience and overall health. The episode underscores the critical importance of the first 1,000 days of life, which set the foundation for a child's immune system and long-term health. Babies are born with an underdeveloped gut microbiome, and during this window, their gut bacteria develop in ways that influence not only digestion, but also immunity, metabolism, and the gut-brain axis. Factors such as birth method, vaginal versus C-section, feeding practices, breastfeeding versus formula, antibiotic exposure, stress, and early diet shape the trajectory of this development. To support optimal gut microbiome development in infants, Hannah emphasizes the use of probiotics formulated specifically for babies, highlighting the importance of appropriate strains and dosages. Breastfeeding is a powerful contributor to a healthy microbiome by providing beneficial microbes, antibodies, and immune signals. As solids are introduced, feeding fiber-rich foods, healthy fats, and balanced nutrients instead of processed, sugar-heavy options helps cultivate a favorable gut environment. Fiber-rich foods like whole grains, fruits, vegetables, and avocado are fundamental for gut health, providing substrates for good bacteria. Healthy fats such as olive oil, avocado, and fish further support an anti-inflammatory gut environment. While fermented foods like sauerkraut and kombucha can complement gut health, Hannah clarifies that targeted probiotic supplements offer more precise benefits because they deliver specific strains in effective amounts. Hannah addresses the increasingly popular use of GLP-1 receptor agonists for weight management, explaining their dual impact on gut function. These drugs slow gastric emptying, which prolongs satiety, but also causes longer intestinal transit times, leading to common gastrointestinal side effects, such as bloating, nausea, gas, and constipation. This slowed motility can give rise to dysbiosis, a harmful bacterial imbalance that increases intestinal inflammation and may persist even after stopping the medication, raising concerns about long-term gut health. To counteract the negative gut effects of GLP-1 treatments, Hannah recommends co-administering specific probiotics, such as omnibiotic detox. Clinical studies show that this probiotic reduces gastrointestinal side effects and dysbiosis risk, and when paired with a lower GLP-1 dose, it maintains therapeutic effectiveness while minimizing adverse reactions. A major misconception addressed is the limited view of the gut as solely a digestive organ. Hannah stresses that the gut is a control center, influencing immune regulation, metabolism, the gut-brain axis, and systemic low-grade inflammation, which underlies many modern chronic diseases, including cardiovascular illness, insulin resistance, diabetes, and cognitive decline. For individuals with unhealthy diets, high in processed foods, sugars, and alcohol, Hannah suggests taking a holistic approach by evaluating lifestyle habits and eliminating inflammatory inputs. Introducing a high-quality daily probiotic, increasing fiber and anti-inflammatory foods, and managing stress are key steps for restoring gut health. Chronic stress disrupts the gut-brain connection and worsens inflammation, making stress management critical. Highlighting the connection between the gut and brain, Hannah discusses research linking dysbiosis to mood disorders and neurodevelopmental conditions like ADHD. With rising ADHD diagnoses, she underscores how poor diet, environmental toxins, and stress may impact gut health and neuroinflammation, contributing to behavioral symptoms. Functional medicine often includes gut assessments and treatment plans for these disorders. Hannah describes how the gut microbiome evolves from infancy through old age. Childhood environmental exposures and stress impact microbiome diversity, which influences immune and metabolic health. Adults face challenges from chronic stress and poor lifestyle habits, while in seniors, decreased microbial diversity affects nutrient absorption and immune responses. Emerging research even connects gut health with Alzheimer's disease progression. Not all probiotics are equally effective. Hannah notes the importance of multi-strain and multi-species formulations designed with specific health targets. Equally vital is ensuring probiotics arrive alive and metabolically active in the intestines. Freeze-dried bacteria can be killed off by stomach acid if delivery systems fail. She prefers powder forms over capsules to enhance survivability through the digestive tract. Women experience gut disorders like IBS and constipation at roughly twice the rate of men, a difference that may relate to hormonal fluctuations and stress processing. Hannah points out that women might carry or internalize stress differently, which negatively affects gut health. The manifestation and awareness of gut symptoms may also differ by gender, though more research is needed. Antibiotic use, especially in children, can radically alter gut bacterial communities, often resulting in side effects like diarrhea, yeast infections, and other microbial imbalances. Hannah stresses the importance of probiotic support during and after antibiotics to reduce these risks and protect against pathogenic overgrowth. Probiotic formulations like Omnibiotic AB10 are specifically designed to mitigate antibiotic-associated disruptions. Many skin conditions, including dermatitis and acne, are linked to gut inflammation and dysbiosis. The gut and skin share mucosal and immune pathways, so disturbances in the gut microbiome can manifest as inflammatory skin issues. Antibiotics may temporarily clear skin problems, but also disrupt gut balance, sometimes worsening skin health after treatment. Emerging research shows that gut dysbiosis and associated low-grade inflammation can negatively affect women's egg quality, embryo development, and overall fertility. Hannah explains that maintaining a balanced gut microbiome with targeted probiotics can reduce inflammation, supporting hormone balance, immune function, and reproductive outcomes. Papaya is highlighted as a potent natural digestive aid due to its rich enzyme content. Hannah shares innovations using traditional Ayurvedic and Chinese medicine preparations that deliver papaya enzymes at higher potency. These products are particularly beneficial for easing constipation and digestive discomfort and are safe for children and pregnant women. Certain commonly perceived healthy foods, like dairy products, can be inflammatory for individuals who are lactose intolerant. While fermented dairy products may promote gut health for some, they can cause irritation and inflammation in others, emphasizing the need for individual dietary awareness. Hydration, especially with room temperature or warm water in the morning, is encouraged for gut health. While lemon water acidifies in taste, it has an alkalizing effect inside the body. Drinking ice water is generally discouraged from a traditional medicine perspective due to its potentially negative effects on digestion. Hannah emphasizes that gut health requires ongoing care, much like tending a garden. Consistency in taking targeted probiotics that match individual health needs, whether for stress, detoxification, or post-antibiotic recovery, is crucial. She advises establishing this foundation before pursuing other health goals or resolutions to ensure the best outcomes. Specialized probiotic formulas designed for infants and children are available, often in palatable flavors and forms that can be mixed with milk or food. Hannah stresses that early and age-appropriate support can aid in mitigating gut-related side effects from antibiotics and help optimize long-term developmental health.